Hi everyone, I'm Casey Smith with the St. John Clark Pain Treatment Center in Clearwater, Florida here. And today we're going to talk about posterior shoulder pain. We get a lot of patients coming in here to the clinic. They suffer from a lot of shoulder pain and they may say, you know, it's a torn rotator cuff or maybe a pinched nerve. And oftentimes the biggest issue that we see with shoulder pain is actually posture and how your posture affects you throughout the day, especially while you're sitting at a desk. So what we're going to cover is how you're sitting, how you're working on the computer, how it affects the shoulder, and some exercises that you can actually do to help correct this distortion so that when you're working for extended periods of time, the shoulder is actually much more balanced and has the strength it needs to help support itself and also help support you and your posture that you should be in. All right, everyone. We have Taylor here, one of our students from the Center for Neurosomatic Studies, and he's going to be demonstrating the really common posture that we see. If you take a look around your office space, say you're working at a desk a lot, or maybe you're a student sitting in class, you can take a look up and look at people around you and you'll see a very common distortion that so many of us carry. Now, as you can tell, Taylor's shoulders are internally rotated and his head is projecting over the front of his shoulders. What this also does is causes his body to deviate over his waistline, causing excess amount of stress throughout the back and causing excess tension in the front of the shoulder as well. All right, everyone. Taylor's been so kind to take off his shirt for us and show us some of the muscular attachments and some of the muscles that are used in this postural distortion here. So, as you can tell, the front of the body, the front of the deltoid itself, your pec, is all contracting and allowing the shoulder blades to actually round forward. This also causes the head to fall off of the shoulders themselves, causing excess neck strain, and also some rounding in the back here. Now, this is a very common posture. If you take a look around your office or your classroom that you may be working in right now, you'll typically find this posture with a lot of different people. It's very common, and this is not the posture that you want to be in while you're sitting for a long period of time. Now, if you will watch, we're going to pull Taylor's shoulders back and push his thoracic cavity in and actually bring his shoulders over the midline of his waist and bring his head over his shoulders. Now, this is a proper position or posture that you want to be in while you're sitting, you're working at a desk for a long period of time, or maybe you're in a classroom. What this does is allows the front of the pec and the shoulder to actually open up and not become overly tightened, and allows the posterior muscles of the back and the back of the shoulder to actually begin to strengthen and use themselves instead of being stuck in this eccentric contraction, making the muscle not only weaker but causing pain in the back of the shoulder as well. Now, what we're going to do is we're going to show you an exercise that you can do to help strengthen some of these muscles and help pull those shoulders back so you can keep a better posture while you're working. All right, everyone, here we are with Taylor, and he's going to help us demonstrate some of the exercises that we can do to help strengthen some of these posterior shoulder muscles. Now, the machine that we're going to be using is one that we use here at the clinic. You don't have to have one of these machines to do these exercises. You can use a simple resistance band you can pick up at a sports store and do these exercises at home. Now, one thing I want you to be conscious of is we're going to emphasize 3 points of contact. Now, we want the sacrum, the thoracic, and the cranium all to make contact. That's letting us know that the spine is erect and you're actually standing upright the way that you should be without that flexion, without the head falling in front of the shoulders. Now, you can do this standing or seated, so if you have a bench that you'd like to use at home, feel free to. Now, the exercise Taylor's going to do is an upper back row, and as you watch Taylor, you'll actually see the supraspinatus, infraspinatus, teres minor, and rear delt actually accentuate themselves and start to contract. These are the muscles that we're trying to strengthen, so if you can, just pay attention to those. Now, what I want to emphasize is on the way back, you want to hold about 5 seconds. As you contract those muscles, you can see the posterior deltoid and the scapular muscles contracting now. You want to hold that for an additional 5 seconds. As you let those muscles start to release and come back and set the weight back down, you're going to want to hold that for another 5 seconds as well. The reason we're holding this contraction for such a long time is these are postural muscles. They're going to be supporting you throughout the day. You don't need the fast, heavyweight repetitions that you would typically see a lot of people doing in the gym. So again, slow, take at least 15 seconds per rep. and really trying to get those muscles to work. You got to understand they're going to be firing all day long. Great. As you can tell, the posterior deltoid and those scapular muscles are firing again. You can tell they're starting to get a bit of a pump now. Those muscles are starting to understand where they're supposed to be holding the scapula, and they're going to keep it in that retracted position the way that we want it to be. Awesome. All right, everybody. That's going to conclude it for our shoulder pain video today. Hopefully some of the exercises and everything that we recommended will help. If not, and if you're still experiencing pain, please come to the St. John Clark Pain Treatment Center, and I hope you have a great day.